Hey, welcome back, everybody. This is Dr. David Fell from Revive Family Medicine. I hope everyone has enjoyed their holidays and has stayed safe. You've probably heard by now some information, rumors, and other things about this Omicron variant that's going around, and it is much more infectious, it seems to be. Started to be recognized over in South Africa. But then the United Kingdom, we got a lot of data from the United Kingdom and here in the United States. In my own practice, my own experience, I have seen more COVID cases. We don't know if they're Omicron in the sense that they aren't genetically sequenced to show that they're Omicron, but the symptoms are very much different for this Omicron variant. Let's take a look at just the rise of this Omicron variant. We see the numbers in the UK, the number of new cases daily are going up significantly. And if you look on the bottom of that, you see South Africa's cases where we saw this starting, they're already down significantly over the last couple of weeks. And so hopefully we'll see the same thing happening in the United Kingdom and here in the United States. We are seeing an increase already, and it does seem to be the Omicron variant from genetic sequencing. But the good news is even though we're seeing a lot more cases of COVID, extremely large numbers of COVID diagnosed by testing, we're not seeing a significant rise in hospitalizations or severe COVID or death. They're not in the UK after a few weeks of going through this, and they didn't in South Africa either. So hopefully we have the same experience here in the United States. But that still remains to be seen over time. It does seem to be somewhat tied to the fact if someone's been vaccinated or not, at least getting symptoms. But here's the hospitalization numbers, actually death numbers per million people is staying relatively the same, and maybe even going down a little bit in the United States because most of that's been happening over the last few weeks has been the Delta variant. So we do see some improvement in there. And you might notice Japan, super low. Super low. And if you look, there's a huge difference in Japan on the number of the problem with obesity in the United States and the standard American diet, not just obesity, and the outcomes to COVID and everything that comes along with it, with the hypertension and diabetes. In Japan, the rate of obesity measured by BMI is around 13%. In the United States, it's over 34%, or right around that number now. So there's a big difference. So we hope our outcomes can start trending more as they have been in Japan and South Africa, that we can start with people being vaccinated, perhaps seeing these lower numbers. Something very interesting. This is a peer-reviewed, preprint article that was recently come out. So it hasn't been peer-reviewed yet, but some fascinating research showing it says, we have also shown that immunity from the infection without vaccination is more protective than 2 doses of the vaccine, but not as protective as someone who has 3 doses, which they call a booster, which it's really just another dose of the vaccine. It's interesting. So natural immunity is powerful, but what they didn't look at in this study, it's out of the UK, they didn't look at the comparison between those who have had the vaccine and have had COVID in the outcomes. Maybe they just didn't have enough data to make it statistically significant. But another thing that's really important to keep, all the patients that I've seen in the over the holidays, I saw quite a few telemedicine patients with COVID symptoms and that had tested COVID, or others in their household had tested positive and they hadn't gotten a test yet. But they had these symptoms. There's a lot less fever. And when I have seen fever, it's been a lower grade fever, and it's usually been short-lived, less than a day, maybe a night. The fevers haven't been bad, and most people haven't lost their sense of smell or taste either. In the coughing, really, there hasn't been very much coughing, but headaches, a lot of people are reporting headaches. These stats are from an app called Zoe, this app where people participate in a study to report symptoms that they're having. Headache, fatigue, runny nose, and are all 65% of the people. And for me, it was more than 65% of the people that I saw that have reported those symptoms. And sore throat was common, and fatigue was varying. Some people like just debilitated with fatigue, and other people like, yeah, I'm just more tired and sleeping more than normal. But more on the upper airways. And there's been a couple of different studies done that are still being peer reviewed. and they look at where this virus is growing. And they're finding that it grows, they estimate 70 times faster than previous versions in the upper airway, in the trachea and the upper airway, which is possibly an explanation for why it's spreading so quickly, is because it just replicates and replicates, and it's not very deep. And it's not penetrating deep into the lungs in most people, which is where we would see more severe problems, or predict that we would see more severe problems. Even the rise in numbers in the hospital can be a little misleading. You got to look a little deeper. It's a lot of those that were in London and United Kingdom, where we're really looking at these numbers, is there was a rise in people who were in the hospital who were then diagnosed with COVID, but they weren't necessarily there for having COVID or needed care in the form of oxygen or ventilation. So when we're looking at hospitalization numbers, it is important to look at those who need intensive care, those who need oxygen therapy because of respiratory issues or in breathing issues, and those who need ventilation and intensive care, as opposed to just being there in the hospital with COVID. So those numbers can be a little bit misleading. It's still very serious, and I still encourage people to consider getting the vaccine. And if you're in a high risk group, the data that we have now says getting a booster is less risky than not getting a booster. Again, though, there's those questions about the Moderna, but we're not here to talk about the vaccines. I would recommend those young men in particular to consider getting the Pfizer vaccine instead of the Moderna vaccine, simply because of the significantly lower rates of myocarditis with the Pfizer vaccine. There was another study, which I won't get into now, that parses all of that out and showing each vaccines and their risk of myocarditis after 1, 2, and 3 doses with each of those vaccines in the United States, the Pfizer, Moderna, and J&J. Well, I hope you found this update helpful here in looking for these symptoms. If you need care, I would still recommend getting care quickly because, well, first of all, it may not be COVID and you might need care for something else, but these are very much like cold symptoms. And the last thing is the CDC's recommendation now are a lot more reasonable than they were in the past. The CDC's recommendation is for a 5-day isolation as opposed to a 10 or 14-day isolation. So people with COVID should isolate for 5 days. And if they become asymptomatic or their symptoms are not improving, you should stay isolated, or 24 hours after a fever, which is reasonable information for any infection somebody might have to not spread it to other people. It's just reasonable information. So you get sick, or even if you're exposed to someone, the next thing that they talk about in there, if you're exposed, they recommend that you quarantine for 5 days, followed by an additional 5 days of mask wearing properly. A little note on mask wearing. A lot of times people say it doesn't work, they don't work, and there's still some questions about how well they work. But most of the studies are not looking at people wearing a mask properly fitting around the nose and the mouth, and air and aerosolization not escaping very easily, not wearing a mask properly, wearing a mask that has multiple layers, wearing, a gaiter really doesn't do anything, and things like that. We know some things really don't do much, but wearing it properly, to be extra cautious for 5 days after. They're not even saying masking all the time in this recommendation, but if you've been exposed and you can't isolate, then they're saying just wear a mask and be diligent about it for those 10 days, especially those first 5 days. Most people, or the median, or is it the mean? I forget which one in the study. When you have, after you've been exposed, symptoms usually start within 3 days for this new variant. But there have been a couple of cases that report symptoms at 8 days, but mostly 3. If you're at 5 days and you're asymptomatic, probably not going to develop symptoms. And so if you are exposed, take some extra caution. Around day 4 or 5, get tested. It's simple. Just get tested around day 4 or 5. But then you only need, according to their more reasonable recommendations, to isolate yourself for 5 days. But even if you can't, they said, and you've been exposed, just be reasonable about it. Be more cautious. Be cognizant of the fact that it can help to wear a mask if it fits properly. Well, I hope everybody is doing well. And if you do need somebody and something to help you through COVID, let me know. I am here and I do a lot of telemedicine for people in other states. I don't treat people in other states, but I can give you a consult on things that you might want to discuss with your doctor on a path that you can take. Stay healthy, stay happy, and enjoy the beautiful weather wherever you are. Try to make the most of it. And I look forward to seeing each of you in the next video. I always love it when people say that. I'm just going to get crazy. I always love it when people say that. Really? I hope I'm not seeing you in the video. Whatever. Have a good sense of humor. Laugh at yourself. Laugh at someone else in a way that doesn't make them feel bad, because laughter is good medicine. So until next time, keep it real, keep it loose, stay relaxed, and have fun. See you guys next time.